My message tonight is really about a call to the brokenhearted, that the brokenhearted may, through their healing, be able to engage in the healing of the nations. I think of a story that Marjorie Gray tells in her wonderful book that I'll share about a little bit later. There was a student nurse, a Canadian student nurse. Cheers my heart. She was ministering in the hospital to a very difficult, very cantankerous, a patient, perhaps if you've done healthcare, you know these patients, who was very angry and very upset. The patient had just come back from the OR and had numerous symptoms, and they had opened her up in the OR and found cancer everywhere, and then just closed her up and sent her back to her room. And she found this out, and she was extremely upset. She was actually an Army officer. Her name is Jill. And she could swear with the best of sailors, and anyone who went in her room, she just lit them up and was extremely difficult to deal with. Well, this student nurse would go in and minister to her and kindly treat her, and would each evening, as she would push on her pillow and talk about how her pain must be so difficult, that perhaps maybe she could pray for her this evening, that God would lighten her pain tonight. And she did this for several days. And Marjorie talks about getting a phone call shortly thereafter. Her husband was a pastor, from this lady who is, on her way to death, calling the pastor and saying, "I want to become a Seventh-day Adventist." And, pastors don't get those kinds of calls very often. And he's like, "Why do you want to become a Seventh-day Adventist?" And she said, "Because of a student nurse who was so kind to me. If that's what Seventh-day Adventists are about, that's what I want to be." I think of my own story. I think of my own grandfather who came and visited our family. My family was in the midst of a heavy amount of brokenheartedness, and it's just not something I want to get into at the moment too deeply, but I had a lot of struggles early in my life, and my grandparents reached out to me and my family for 3 full years, and my mother had become very sort of negative towards Christianity and had been in a frame of mind therein, and I really had very little exposure to Christian things. But what I did find as I started to get to know my grandfather, and I remember when he first got there, my mom said to him in front of the whole family, "If you teach any of your brainwashing to my children, you're out of here, you hear me?" My mom never talked about religious things. So that was really shocking to me. Here I am, 14, looking at my mother thinking, who is this woman? I didn't know her, I felt like. And yet, my grandparents proceeded. My grandpa just smiled at my mother, didn't say a thing, and proceeded to minister to my brother and I. And at that point, I was the most open to it. And for 3 summers, they started showing us who Jesus was, started telling us about the love of God. And I saw in my grandfather love that I'd never seen before, and kindness that I'd never seen before. He wasn't the man I'd heard about. I heard that he was a major in the Army, that he was a stiff man. He got the children up at 5 a.m. to exercise every morning. And he was very, that German, kind of focus. But that wasn't the man I met. He was a man who had been changed by Jesus, amen? And that's the kind of love that we need. If we really want to become a ministry, if we really want to do medical missionary work, we've got to have our own hearts change. We've got to be willing to reach the brokenhearted. It says in Psalms, if you have your Bible, it says in Psalms 34:18, "The Lord is close to the brokenhearted and saves those who are crushed in spirit." That was my upbringing. Had a very angry mother at times, and really struggled with that. So tonight I want to share a little bit about that, some early concepts as it relates to my growing understanding of medical practice versus medical ministry. And then the formation of the clinic that we've had going for the last 3.5 years in Chattanooga. And then a little bit more about God's love in action and future directions. So through that process of my grandparents visiting me, I went from a person who was dead in trespasses to being alive in Christ as a teenager. My life was totally changed. I had totally new desires, totally new interests. And, I remember going through this whole process of realizing so much of my life was just not what I wanted to be anymore. I remember throwing away unholy music and unholy magazines that were in my midst. I remember starting to change my diet and so on, just because God was starting to talk to my heart, just because I started to realize that my body was the temple of the Holy Spirit. I didn't realize that before. I didn't know that. And I started to take that seriously. I started to make changes. The main theme of our family was entertainment and sports. And I had been and my parents had been devoted to very much turning me into a professional athlete. Very much so. We were very much involved with exercise physiologists and a lot of extra training and a lot of discipline to become a professional athlete. And my particular sport that I was very good at was baseball and pitching. But, I began to lose interest in that. And I began to gain interest in what Paul talks about in Acts 17 when he's talking about the Greeks being there, saying so that they should seek the Lord in hope that they might grope for him. Here I am. I know nothing about anything, about who God is. I'm totally, completely ignorant about the Bible. I remember turning open the Bible for the first time. My grandparents had given me a Bible. This was in the third year. I was really starting to get interested. And I was looking at the table of contents. I was trying to figure out the difference between the Old and the New Testament. And I was like, Old Testament? That sounds like death. New Testament. And I didn't really understand. And my mom walks by and she scoffs at me and she said, "Greg, I thought I'd have to deal with drugs or something, but not this religious fanaticism." And so that was my upbringing. And yet God's done a great work in my mother. Maybe I can share a minute on that. And so as I went through that process of starting to relate to Christian things, starting to understand who Jesus was and the kind of ministry he had, I learned the word humanitarian. And I was like, you know what? That's what I want to do in my life. Here I am, 17, 18 years old, kind of trying to figure out what I wanted to do. And it was super broad. I didn't really know. But I want to do something humanitarian. I want to help people. I want to do something to make life better for people. I don't want to just be an object of entertainment at a ball field in front of a bunch of drunk people. I don't want to do that anymore. But I had some issues. I had some deep fears I had to deal with. I had a lot of social anxiety. I had a lot of issues emotionally that God had to heal me. We started to attend church. I wish I had time to tell you that story. And at church, we got introduced to this program called the CHIP program. Anyone heard of this? And man, we took this thing by storm. We were so excited about it. I remember volunteering, sitting with the people, listening to their cholesterol's coming down, their blood pressure's coming down, their weight loss, their depression lifting, and thinking, man, this stuff's amazing. I never heard about this in my life. I remember getting so excited about it that one summer I was like, you know what, I'm going to be a coal porter. And I just decided I wanted to coal porter one book. I don't know if you remember the book Health Power by Hans Diehl. I went around and started, I didn't know anything about coal porting. I didn't know how to talk to people. I had terrible social anxiety. I didn't know how to do anything, but I started knocking on doors trying to sell books. And I was having a rough go. And ended up, God had mercy on me and started funneling all this energy to a CHIP alumni, and I started selling books to CHIP alumni, and God blessed it. I remember reading The Ministry of Healing. If you haven't read that book, do it today. Get going on that. You know, just the first part of the Ministry of Healing is so amazing, the way it just shows you exactly how much Jesus loved people. And that's what we need. We need that in our hearts again. If we don't have that love of people, you know, it's not going to matter, all this stuff, all the ideas and all the ways that we can make these things happen. We have to have the love in our hearts. And as I got ready to go to med school, I was getting ready to go to med school, and there were some delays, and I ended up having a year off. And I had a buddy that I knew named Richard Rushworth, and he was part of our youth group. I had joined this youth group. He was growing me greatly in my Christian walk. And then he just suddenly disappeared. And didn't know what happened to him. He was kind of a solitary guy. We didn't really know who to call. Find out 6 months later, he calls me up, and he says, I know I've been kind of absent, but I had to go to Eastern Canada because I got multiple myeloma, and then my kidneys failed, and I needed my sister to help me while I was going through a horrible process. And I want to come back home, but I'm so weak, and I don't have anyone to help me. Would you help me? And here you have some free time. And so I went and got my first taste at caregiving. If you haven't had that taste, it's really good for your soul. It's really hard on your psyche sometimes, but it's really good for your soul. And there I did, cared for another cantankerous man. You know, he was a locksmith and just very particular about everything. And I remember one story where he loved the sound of water rushing down the sink when he pulled the plug on these old-fashioned sinks. Whew. Man, he loved that sound. Well, as we went through my time with him, the sound started to get slower and slower and slower. And so his determination was that we needed to change out the sink device in the middle of the sink. And so we go on down to the hardware store, we get the device, and we go ahead and get home, and he's like, go downstairs and get the big pipe wrench. I'm like, okay. So I go downstairs and get the big pipe wrench, and he's sitting on the toilet staring at, it was an open sink. He's like, see that right there, right underneath the sink? He's like, put the pipe wrench on there and go ahead and turn it. And I looked at it, and it looked like one piece of plastic to me, even though it was sort of, structured in a way that might deceive you. And I was like, I don't think that's the way this works. And he's like, Greg, do it now. I'm like, okay. So I put the pipe wrench on there, and I just sort of feigned trying. I'm like, oh. And I didn't want to pull too hard because I didn't want to break it. And he's like, give me that thing. And so he tries to pull it, and he's on dialysis. He doesn't have any strength. And after 2 seconds of that, he's huffing and puffing. And so then I, waited for a while, and I then I took a screwdriver, and then I proceeded to wind the thing out the top, and then took the the packaging and put the new one in, and filled the sink up with water, and then pulled the plug. Whew. And at that moment, I realized that, you know what? Patience and kindness and long-suffering is amazing. It does so much to bind you and bring you together with another person. Even when they're being difficult. Man, that's hard to learn. Going to Africa for medical missions, that's where I met my wife. Amazing experience. We won't have time for that. And then I applied to medical school. And, God has his amazing ways. My grades were fairly good, but, I was not, I was kind of on the edge of really being able to make it into Loma Linda. And so I'd gone through an experience where I wasn't sure if I was going to get into medical school, and so I decided I was going to look at other options, and I thought that maybe being a EMT might be a good idea. And so I talked with the bus driver of the school that I went to, and I said, hey, would you teach me how to bus drive? Because it was the same license for ambulance driving. And so he taught me, and we got to know each other pretty well. And I go down to med school to apply, and they invite me, and I get an interview, and I'm sitting with the dean of admissions, and he's looking at my paperwork, and he says, "You're from Langley, British Columbia, huh?" I'm like, "Yeah." And he asked about the school. I tell him that I went to, and he's like, "Do you know my brother?" I'm like, "Who's your brother?" And he says the name, and I'm like, "He was my bus driver." And so we talked some more. I thought that was kind of weird. And I found out later from his brother that he had called his brother and got a reference from his brother. And I think that's how I got into med school, through a miracle. Had a great time doing CHIP programs and deadly depression programs in med school. I got to know Hans Deal pretty well, God rest his soul, and learned a lot about lifestyle medicine. Got to know John Kelly as he was just starting the ACLM, early involvement with that. That was a blessing and a wonderful exposure for me. And then at my fourth year of med school, I toured lifestyle centers. God was preparing something I didn't know what for. I get into residency of family medicine, preventive medicine residency. That was a kind of a crazy thing. When I applied to residency, I applied to multiple different residencies, but I also applied to Loma Linda, and I wasn't really sure where God wanted me. I thought it was probably Loma Linda. And when I went to Mayo Clinic, I hit it off with the residency director pretty well, and had a good interview process. And then this residency director proceeds to write me personal letters, 4 handwritten personal letters, over a series of months to try to convince me to go to Mayo Clinic. And I just remember this struggle inside of, Lord, God, God, what do I want? What do I want? Do I want the more humble kind of ideas related to this longing? I didn't even really have full words for it, but this idea of medical missionary work, not even really understanding exactly how that all worked yet, and struggling with some kinds of different competing ideas. But at Mayo Clinic, I just got the impression that if I went to Mayo Clinic, my personal motivation would have been just the glory and the beauty. I just remember looking at the halls, and they looked like they were paved with gold. The place was just like gold. And I was like, I don't know if this is right for me. And so I applied, and sure enough, I went through the match process, which is sort of a random thing, and I got into Loma Linda, and I'm grateful. Finished residency and looked at a number of options. My wife wanted to get out of Southern California, and her sister lived up in Oregon, and so we moved up that direction along the Oregon coast. And that was a fun time, those 3 years that I was with Bayshore Family Medicine It was a family environment. It was a small environment. The son of the owner was the business administrator. Him and his wife were the leaders in the clinic in terms of clinicians. And man, I just love that. There was just something very special about that camaraderie, that togetherness. If you haven't been able to work for a family-run process like that, that's healthy, it's a lot of fun. And here I am, my ideas, trying to figure out, we were running CHIP programs, and we were engaged in a lot of lifestyle medicine process, but we really I hadn't learned how to bring in this idea of how do you share the gospel, really sharing the gospel. I'll get to that more. And then I went through a bunch of difficulty related to some of the personal problems that were occurring between the husband and wife of the practice, and ended up leaving that after a while and wanted to start a group medical program where we were doing group visits, because I saw that when you put people together in groups, you got a lot more done, relationally and emotionally, spiritually, and just education-wise than one-on-one with the physician. And so we had a lot of success doing that, but was not really able to fully get it done. And the reason why I wasn't fully able to get that off the ground with the Programs for Health business is that I wanted to serve the poor. And so I started applying to get credentialing with the various insurances for this business. And I sought credentialing from the local Medicaid provider in Oregon there in the county. And they write me this email back saying, sorry, it's the medical director of the health insurance, sorry, for Medicaid, I'm sorry, you're not going to be able to go ahead and do this business, and we're not going to credential you for Medicaid. Because if you want to do that, you have to do it with the big system in that county. Well, without getting into all the details, I had already tried to do it in that big system, and my experience in that was such that it just could not be done in the big system. At least that was my impression. And it had to do with the siloing and just the fact that they weren't really ready, and it was difficult for me to educate the various pieces of the process. And so I decided that I needed to move forward in something different. I started doing hospice work, and it was in the hospice work that I really learned to pray with patients. That is one thing you have to learn. How do you pray with one another, and how do you, as a clinician, pray with your patients? That's not something that's easy to learn, especially if you don't have adequate training, and that's something that took me a while to learn. And then as part of my growth process, and as the Lord was getting me more and more comfortable with these ideas of spiritual things, my father-in-law gets cancer. And he's from Chattanooga. And we could see the writing on the wall that things were just going downhill fast. And so my wife really urged me and said, we really got to move out there because my mom needs help. And so we sort of hightailed it over there. I started hospitalist work in Chattanooga, learned more about how to pray with patients, how to spiritually minister to patients. And my father-in-law died Christmas Day 2019, and that was a very difficult experience for my wife and I. And about 6 months later, my wife turns to me and says, honey, I am so glad that you picked up your career. I know you're trying to get that Programs for Health thing going. You had some ideas brewing. You were thinking maybe starting a clinic in one of the local towns there. And I'm just so glad that you picked up your life for our family. You know what? Whatever you want to do, wherever you want to go, I'm going to be behind you. How many wives say that to their husbands? And that got my juices flowing. It was that moment where I was like, okay, sky's the limit, let's go. And I began the process of study, brainstorming, scripture, Ellen White, looking around, trying to understand what would it be, what would it take to truly do a medical ministry. And while I was in this brainstorming process, I found out there was an Adventist lifestyle medicine clinic in town, which I didn't know about. And so I proceeded to go over there and check it out, and I wanted to get involved. And as I started that process, I met Rick Chrisman, and he was the COO of that clinic. And we hit it off. Rick, if you don't know him, he has been a pastor and a colporteur, and he has an administrative personality, and he's a good organizer. And he started trying to pull me into the clinic. But as he's doing this, he's struggling because he's seeing this clinic kind of going sideways mission-wise. And he's trying to promote the clinic to me on the one hand, but on the other hand, he's like, I don't know. I mean, I can tell what you're kind of really wanting to do. And they're getting pulled into this financial model where it's run, go, fast. Make as many dollars as you can with each patient. And I'm not sure that's really ideal for what you want to do. So it kind of broke off, and I was still praying and thinking and beginning the process of how I was going to start something. And then I met Rick at not Pathfinders, for the little kids, Adventurers, a few months later, and I saw him there, and I was like, "Hey, Rick, what are you doing, buddy?" Because we hadn't talked in a few months. And man, I mean, this is like the most upbeat guy you'll ever meet. He's like this. I'm like, "Are you okay, man? What's going on?" And he says, "I quit my job, and I don't know what else I'm going to do now." They were just losing their focus, and I just knew that God didn't want me to do that. And as I looked at him, I was like, "Rick, do I have an idea for you?" You know what? God can turn sorrow to joy, can't he? And so I just want to share with you a little bit about what started to happen during those mornings. We'd meet early in the morning. I would usually start, work at 6:37 as a hospitalist. We'd meet at 5:30 in the morning and prayer walk and brainstorm and dream and pray and ask God, what would you have for us to do? How would you have for us to build this? And that's how the idea of Life Med Clinic was born. And so I want to share with you a little bit of that brainstorming process so you can start to see how this is different than how it's usually built. I don't know if you've seen this graphic before. To me, it's really been meaningful as I've been trying to labor with understanding the blueprint that Ellen White designed for this church. It's a beautiful blueprint, and it's, I think, really important, this distinction between city mission and outpost mission. The idea of treatment rooms, restaurants, churches, house-to-house ministry, working in the cities. Then the idea of being in the country and having publishing houses, food factories, training, lifestyle center, agriculture happening in the country. This is the way God designed it through Ellen White's inspiration. And what I realized what God was calling me to was this idea of treatment rooms in the city, what we call clinics now. They didn't really use that term back then. And that's what I want to talk to you about. So how is this different? So just starting broadly, this idea of God's love must be forefront. It must be center. It must be the motivation every day. And instead of saying, how can I see this patient as fast as I can, or how can I give them a script to, prescription to get them out of the door as fast as I can? How can I diagnose this as fast as I can? My question now is, how can I love this patient the best I can? How can I reveal God's character as he's starting to give that character to me through his process of me giving him my sin and him him giving me righteousness, as 2 Corinthians 5:21 outlines, the greatest transaction ever to occur in your life. So this idea of love and kindness and tangibly sharing the gospel. And so one of the things that has been sort of a bulwark of struggle with me is the way I was trained, lifestyle medicine, preventive medicine. This is such a strong part of my training that, and it's an important part, but to start to realize that's not the full goal. That's not the central goal. That's part of what we do. That's part of what gives this power. But it's not the first part of the goal. And thank you, John, for coming up with this. Stage one, where you're starting to get into it and you think, okay, we're going to prioritize preventive care. We're going to help people prevent disease, which is wonderful and good, and we need to do that. And then stage two, you start embracing lifestyle medicine. We're going to help them change their diets. We're going to help them with exercise. We're going to help them lose weight. We're going to do all these things with stress and sleep and all these pieces, and we're going to help them engage that process. Natural remedies, massage, hydrotherapy, all these different remedies, sunshine, all these different things to help them start to alleviate disease. And then in the third stage, you're starting to realize, hey, wait a minute, if I what's this Bible verse? What does it profit a man if he gains the whole world and yet loses his soul? And I would say to that, what does it profit a man if he lives 100 years and loses his soul? Does it profit you anything? No, it doesn't. And so this process of realizing that whole person care is more this idea of, okay, how can we spiritually minister to people in order to get better health outcomes? That's how I was taught in school. It was all about the health outcomes. It was all about, okay, we're going to engage, help people engage relationship, help them to emotionally go through healing so that we can have better health outcomes. And that becomes kind of a focus at times and a major kind of direction. And yet there's something much greater that God is calling for us for, and that is, how do we bring the gospel, and how do I become, as a physician, a gospel worker as well, an evangelist as well, someone who preaches the gospel as well. One-on-one, gently, tactfully helping people. Because, just like it's been in my heart, until I had Jesus in my heart, it was a mess everywhere I went. Ultimately, and that's what we need. Okay, so saving not just bodies but souls. Here's some of Ellen White's quotes. Christian physicians' work is not only in the healing of the body, but also of the mind and the soul. The soul. I don't think most doctors think that way. The physician has two responsibilities: as a skillful physician and as a what? Preacher of the gospel. I don't remember learning anything in med school about preaching the gospel. Nothing. I guess that's not totally true. That we had an elective, and I, out of my own interest, chose a preaching class, but I had no idea about this quote back then. I just wanted to do something that dealt with my social anxiety and helped me fight it. And that was my motivation at that point. And obviously I wanted to learn how to share Jesus better, but I didn't really think of it as my job, as my career, as my calling, as God's calling upon me and upon all of us who long to share health and the gospel with people. The third one there, both the physician and the gospel minister have been committed the highest trust. What is it? The cure of souls. That's what we're supposed to be doing. It is the work of all, including Christian physicians and missionary nurses, to reveal to men the gospel of their salvation. Every enterprise in which we engage should be a means to this end. We've got to get that clear in our heads. I do. And it's taken me a long time to get there. All right, so there's these principles that we want to do. We want to bring the health worker into a spiritual work mode as well. Even though the focus is physical, and we're talking about physical things, we are realizing that there's a spiritual aspect here, because if you fix the foot and yet the heart's still broken, have you really helped them that much? Yeah, maybe for a little while you help them, but they need that deeper healing. We need a blended ministry. Health worker, clinician, physician, whatever you want to call them, working together with a Bible worker minister, right? So we've been talking about that already. This spirit of sacrifice. There's a lot I could say about this. This idea of me as a physician being willing to take less wages for the sake of sacrifice so that it makes a bigger impact on my patient. That is a huge deal. And that's not easy for physicians to do, and it's sort of a dying on the rock experience for us. Cultivating compassion and love for those who are suffering, we talked about that. A deep understanding of physiology in order for effective lifestyle treatments and simple remedies to work. You've got to really understand these things. You've got to work through it. It's happened. I've had situations where, we were trying to do the simple remedies and the lifestyle treatments, and we didn't understand the physiology well enough, and we weren't getting anywhere. Okay, so that happens too. And so we need the deeper understanding of the physiology. And that's one of my goals. Okay, how is it different? Again, do I need to say it? It's about Jesus only. He leads us to do loving acts of healing. We speak the words of life to the patients as the words of life come into us. Thus, by the Spirit's action, we become the loving character of God to them. Not because there's anything good in us, but because the Spirit is working through us. Our human weakness results in godly power. By His power, He prepares a people for the second coming of Jesus, where He personally will come to make the kingdoms of this world the kingdoms of our Lord and of His Christ. And He shall reign forever and ever. Amen? Christ cooperates with those who engage in medical missionary work. Did you hear that? Who does? Is that something you want? Is that something I want? You better believe it. Men and women who unselfishly do what they can to establish sanitariums and treatment rooms in many lands will be richly rewarded. You know what's happening is we are having, from COVID, what happened in COVID that I saw, at least down south, is a lot of people moved in the country, Adventist-wise. And we have all these different Adventists who have some health skills, who have the potential to do home-based lifestyle centers. And we have 3 or 4 of them now running around Chattanooga that we are starting to send our patients from the city out into these outlying places. And we're just in the very early stages of this. We're just learning how to do this. And I think it's something that is powerful, and perhaps there's one here who feels a calling to engage the process of a home-based lifestyle center, caring for people, teaching them how to eat better, and how to exercise, and showing them Jesus through that process. So there's a lot of different kinds of things. We looked a little bit at that. Clinic-based ministry, that's what I'm doing. Home-based country lifestyle center, institutional lifestyle centers, outpatient lifestyle programs, food-related services, all these different pieces that can have this spiritual effort. Health instruction, counseling, nutrition, etc. We've mentioned these already. Okay, so as Rick and I were talking about, we were talking about all these things, and we pared it down to these details. We wanted to share God's character of love. We wanted it to be Bible-honoring process. We wanted to apply Ellen White's counsel. We wanted to blend the health and gospel work. We wanted to be a center of influence in the city. We wanted to be supporting of other SDA institutions. We wanted to be an Adventist health ministry built on Adventist principles of health. We want it to be lifestyle medicine, and we wanted our clinicians to be lifestyle medicine certified. And we want it to be a direct primary care clinic where the finances are very simple. And we made it a nonprofit because we didn't want it to be primarily motivated by money, though the money had to work. And we sought ASI and OCI support. And so I just want to talk a little bit about this. Okay, so we talked about sharing God's character and healing. It's Jesus who is the great physician. He heals our diseases. He's the one who is able to ultimately heal. He's never lost a case. And it may seem like physically the person's degenerating, but if they give their heart to God, he hasn't lost that case, has he? He has not. He will resurrect that person potentially at the last day. Love the Lord your God with all your heart, mind, and soul. Love your neighbor as yourself. That's what this is about. Jesus Christ came to this world as the unwearied servant of man's necessity. You know, when I'm really struggling with being tired and there's another patient calling, I quote this verse. You know, Jesus did it. Why can't I? Jesus was kind and compassionate even though he was tired. Why can't I be? He was moved with compassion on the multitudes. God looks upon those with intemperate habits, with pitying tenderness. Do we do this? When we see someone struggling with some sin or struggling with some bad habit, do we look on them with pitying tenderness? Or do we judge? He understands all the circumstances that have led them to fall under temptation. Though some have viewed them as hopeless, God wants us to labor for them. So there's this idea of God being love, sharing the gospel, performing acts of healing, and through this process, teaching them about God's law, right? And that is, I think, a beautiful thing to help them see what God's love is about. You know, tangibly, hands-on, experiencing the mind changes of the gospel and the spiritual changes of the gospel, and then starting to see as they obey God's law that good things are happening in terms of cause and effect. And that is beautiful. So every act of love is an act of healing. Acts of healing are expressions of God's grace. We should lead with healing. If we lead with healing, we lead with God's grace. Every act of healing is an act of love if it is done in love. To be done in love means it is also done in obedience to God's law. All right? We have to teach this as well, which is not always easy to get to, but we need to press ourselves into it. God's character is in his law. Every act of love must express obedience to God's law. Obedience to God's law brings and maintains healing. I mean, there's so many principles in the Old Testament that bring this forward, and we'll get into one or two of those. Okay, so Bible honoring, just one detail in this. I mean, I wrote a whole paper on this, trying to detail out all the health principles in the Bible. But here's just one, and a quote from Ralph Major from the History of Medicine. Moses was the greatest sanitary engineer that the world has ever seen. Moses recognized the great principle that the prevention of disease is usually simpler and invariably more far-reaching than the cure of disease. His doctrines in the book of Leviticus could be summed up by the objects of sanitation today: pure food, pure water, pure air, pure bodies, pure dwellings. Isn't that amazing? I mean, we take a lot of these principles that we just live with today like they're easy peasy, that we just know them. They were fought hard for through the last couple hundred years, were they not? And the influence of the scriptures played a role. Ellen White's counsel, just a few kind of detail items that we sometimes struggle with in our institutions. Do not serve flesh food to patients, period. Seek to ascertain cause. Every person should know the true remedies: pure air, sunlight, abstemiousness, rest, exercise, proper diet, the use of water, trust in design power. These are the true remedies. Use treatments that assist nature. Don't engage in actions or treatments that repudiate nature. Okay? And so that should be the focus. Physicians should not demand high wages. Ellen White writes a whole long letter to this administrator in New Zealand. This is in manuscript releases. A letter 330. Anyways, begging this administrator not to hire this physician who was demanding high wages, because she said that the influence would completely, or the high wages would completely wreck the influence of trying to spread the gospel in that area. Isn't that crazy? Just the high wage demand of the physician. Just that. And so that's something we need to contend with. And this isn't the only place she said it. She said it multiple times. And this was a hard thing for me to get around because, as a hospitalist, I was making lots of money. And as I jumped into this ministry, we decided to take wages similar to pastors. And that's been humbling. It's, my heart sometimes pushes against it. But I know it's the right thing, and that's what I'm going to do. And that's what we're doing. Avoid large institutions. No large business firms in the cities. Due to adverse conditions in the cities, the Lord would be pleased to have several small country sanitariums instead of one mammoth city sanitarium, speaking about Battle Creek story. Avoid hypnotism, etc. So there's just so much stuff in there that we can use to get advantages, that is going to really help us as we care for patients. The human family is suffering because of transgression of the laws of God. Transgression of laws of nature is transgression of the laws of God. The Lord desires that men shall be led to understand the cause of their suffering and the only way to find relief. He desires them to see that their well-being, physical, mental, and moral, depends upon their obedience to His law. All right, we're still all learning this, aren't we? Are we not? When we eat too much or we do the wrong thing and our stomach is giving us trouble, we are saying sorry to our stomachs, aren't we? Sorry, stomach. Or if you don't get much exercise one day, you should apologize to your pancreas, because your pancreas has to work overtime that day to keep your blood sugars down. When you exercise and you start moving your body more, your pancreas's job is way lighter, way easier. Did you know that? There's research that documents that out. Centers of influence, perhaps you've heard about this. This idea of treatment room. This is an indoor room where natural remedy treatments can be applied to the one in need, most often in the city, but occasionally she speaks of treatment rooms as existing in a sanitarium or even in a church, which is usually outside the city. Well, the churches are in the city. Sanitarium, a place usually outside the city where those with medical problems get treated largely with natural remedies. Okay, so it's this outside the city, inside the city idea. And that's the distinction. And so she talked about 3 parts to it: health food stores, hygienic restaurants, and treatment rooms that should be established in the cities as centers of influence. And, I didn't know this stuff. And it's taken me a long time to just really put it all together and realize it. So treatment rooms as a city clinic, place treatment rooms in the city so the people become acquainted with methods of rational treatment and with the success that attends the use of these methods. Once the treatment rooms are in place, then proceed with a sanitarium outside the city. The treatment rooms will act as a feeder for the sanitarium. These 2 places, properly managed, will become a power of influence in medical missionary lines. A what? How come we're not doing this? Where are we doing this? Very few places. So what are our options? Clinic on the grounds of a church, clinic on its own property where a church could grow up. Church and clinic could be on different properties near each other, positioned strategically. All right, so it just depends on the situation, the characteristics of your community, and so on and so forth, what would be the best choice. You're trying to draw people into your clinic setting. Want it to be SDA Christian supporting. So this idea of rather than competing against one another, we're helping one another, right? So in an institution that's already established like ours, what we're engaging in is we're doing our best to try to help other institutions get started, other clinics get started. We are involved with clinic planting. through our assistance and help and our experience of what we've learned through some of our hard knocks and some of the successes, and trying to share those things with each other. And that's exactly what Ellen White urges us to do. Those institutions that are already established will be given the opportunity to cooperate with him in assisting newly established plants. Every new institution is to be regarded as a sister helper, not as a competitor, even if you're in the same city, as a what? Sister helper. In the great work of proclaiming the third angel's message. We want it to be an Adventist health ministry, so we openly state this in our bylaws. We will not be ashamed that we are Adventists. We are going to stay Adventist. We will allow non-Adventist volunteers to help us as long as they align with our mission and vision in their conduct, but we want our employees to be fully aligned with the vision and the understanding. We will run health programs and so on, and you know many of these. We decided to make all our clinicians lifestyle medicine certified from the American College of Lifestyle Medicine, so they learn how to treat disease through simple lifestyle-oriented processes. And so these are some of them. We already know them well. All right, so and then the direct primary care model, we're into the Sabbath here, so I don't want to get too much into this. But it's this idea of helping you run the lifestyle medical ministry better, okay? So it's not about rushing through patients. It's about high-quality relationships. Patients less likely to end up in high-cost healthcare settings such as ED, urgent care, and specialists. We already have studies showing that direct care does that. For a much more a reasonable fee that we just charge monthly, better adapted for conveniences of modern technology. I don't worry about getting the patient in and sitting in front of them just to do a refill or just to whatever it is. We can just text each other. My patients are texting me all the time with questions. Oh, I got this thing on my leg. All this stuff, like endlessly. You don't have to take a half day off work to go see the doctor to check out the thing on your leg. If it's something that can just be taken a picture and I can make an assessment with the picture, then I'll do that. And so that saves patients a lot of money, a lot of time. It gives our clinic a stable monthly income. Even if we have no-shows or whatever, we don't worry about that because our income's very stable every month. Direct care more easily motivates helping patients save money on healthcare costs. We're motivated to, have them, more well, and we don't have anything kind of keeping them coming back. We don't need them to keep coming back. We don't have any motivation for that. Once there are adequate patients, can start running health programs and so on, and we're doing that already. And then we made it a nonprofit. We wanted it to be focused on that. And this is a debate that you can have. There may be situations where a PLLC is more appropriate, but in general, it's easier to work with local churches if you're nonprofit. A nonprofit has the ability to expand ministries through donations that go beyond membership and fee for service, and we're doing that. We're holding fundraisers and so on. We'll get into that. Nonprofits are able to have an accountable ministry mission that guards against the real challenges and perceived views of a PLLC as a for-profit. All right? If the patient thinks you're just trying to make money on them, it's hard to have an effect for the gospel, right? And that's not the goal. That's not what we want. And then the ASI supporting, to be ASI supported, your board has to have at least 5 members that guide our clinic. And we follow the guidelines that they prescribe for the bylaws. And we've also joined OCI, Outpost Centers International. And, they've been supportive of us as well. All right, so LifeMed Clinic. This is our mission statement. We worked hard to build this. LifeMed Clinic provides direct primary care service with an emphasis on lifestyle medicine. We provide whole person care, which includes physical, mental, social, and spiritual health. As a nonprofit 501c3 organization, our mission is to reveal God's love by restoring the whole person through lifestyle medical ministry. We want to partner with you to create better health outcomes by providing compassionate service in a timely manner. So we're talking about those different stages. We're interesting them in their better health outcomes because that's why they come to the doctor, right? You know, they don't come to the doctor thinking, oh, I want to be closer to Jesus. They don't. They come to the doctor because their leg hurts or their tummy is a struggle. And through the process of loving them and caring them, you can show them a little bit about God's love. And that can help them grow in that desire. All right, and so we got a staff rolling. We opened in May 2021. It's a beautiful story. Really a miracle of getting Jeff, our nurse. We had put up the website. It still had a lot of Latin on it and stuff. We were working with the company and just designing the location of the boxes and all that kind of stuff. And Rick gets an email through the contact us form that just happened to be on there that we didn't even really realize was on there from Jeff saying, I'm really looking for a doctor who is, sort of down your lines. I mean, all we had said was Life Med Clinic, and we wrote one line about it. That's all we had done that thus far because we weren't really ready to put this website up prime time. And so Rick reads this letter, and he's like, that's interesting. So he calls up Jeff. Jeff gave his phone number. And Jeff's like, I have 100 patients, and my doctor's trying to retire, and I've been looking all around. I can't find a doctor who wants to take these patients. They're wellness patients, and some of them have some addiction issues. Do you want them? They're all cash-based. We're like, whoa. So we start to talk about it more, learn more about it, and we find out Jeff's, a fellow Adventist believer, and the Lord just put it together. And so on day one, we were busy. We were still learning how to use our computer and our EHR and all that stuff, the electronic health record. But we're already busier than we've been busy ever since. So here's some of the things we offer: the longer visits, the quality care, just more able to respond because we don't have 3,000 patients we're trying to care for. Right? Part of the reason that you can't get in for 6 months, or you leave a message and then it takes them a long time to call you back, if they do, is because they have 3,000 patients they're tending for. That's why. And they're just overwhelmed. They're just way too busy. And so we've been more careful with that. And then a consistent pricing model so we can maintain the finances in a safe place. And yet focus on the actual ministry process. We are very interested in helping the poor. When I found out about the sliding scale idea, that really sold me on this because I really had a burden for the poor. And I was like, how am I going to help the poor if I'm doing a cash model? Well, this is how. We give free care to patients. We balance the income we're getting from the consistently paying patients with those patients who can't pay. 35%, 40% of our patients have some kind of free or discounted service. And that makes a huge difference on the ability to love the patient. Does that make sense? Rick's been so amazing about this. A paralegal called him up one day who's our patient, and she's like, I just lost my job. I don't think I'm going to be able to continue the service because my money's drying up fast, and I don't know where to get a job. It's going to take me a little bit. And Rick's like, don't worry about it. We'll just make it free for a little while. Go get a job, and then let's talk. You know what that does for people? She was in the middle of working through a difficult health problem right then. Can you imagine just having that dropped and having to find a new doctor? That's no fun. That's difficult. That's stressful. So we moved to... before we moved, this was our staff started to grow. By early 2022, we got some volunteers. Elizabeth Perry joined us as a nurse practitioner, and our busyness was growing. And we were making choices in our staff based on the content of their character, the way God had led them, the mission alignment, etc. And that was what we were doing. We moved to our new location. We started with a 300 square foot place, 300 square feet. 3 big guys. You see how big my guys were? Rick and Jeff, I can't even get my arms around them. They're way bigger than me. And we were in this little 300 square foot place, and God blessed it. And it's the relationships, right? It doesn't really matter where you are. You need somewhere that's clean and safe and so on, but it's the relationships. And so we're starting to get some more staff. We grew a little bit to provide better service. And we moved to this new location. We started to engage some hydrotherapy processes. And here's another shot of us. We had a visitor from, a lady from Argentina who engaged the hydrotherapy very aggressively. We really enjoyed having her and for a little while. And then in our 2-year anniversary, we were starting to get excited. Hey, this might work. 2 years. We're still afloat. Businesses are hard to run. We engage in fundraisers. The Lord really blessed that and gave us money to be able to help the poor and the people who didn't have the money, the underserved, etc. And here's some of the shots of our last fundraiser. Did a lot of fun things. Here's some of our staff, and just a few shots there. And so, I just long for more people to go do this. Go do this. Whatever your calling is, go and engage in the city mission process. If your calling is in the country, engage the country process and begin the process of figuring out, how do I love people? And how do I love them in a healthy, promoting way? And that, I think, is a powerful, powerful thing that we haven't even started to tap into. Better relationships. I just want to learn how to have better relationships with my patients. How do I continue to heal my struggles with, I got a fearful avoidant attachment issue from my childhood. How do I continue to heal from that and be able to connect with my patients better? Pray with patients. That's a top priority in the visit. Every visit I can, whoever's open. Engage Bible studies in the visit if we can, in the home, as it's relevant, as it meets the needs that they're having right then. We have a newsletter. We're engaging Adventist. We're advertising local Adventist church programs. We're engaging in a process where we're getting to know health ministries leaders in the various churches better, and we're beginning a process through our care team coordinator with the local conference has blessed us with. He's the name is escape me now. He's basically a Bible worker. Evangelism trainer, that's what they call them. And we've called him a care team coordinator, and what his job is to go out into the communities and figure out the felt needs, figure out how to serve this person, how to love them in their home, and engage in Bible studies through the spiritual methods. And it's working wonderfully. In fact, this last week, he's been doing Bible studies with one of our patients that we've been ministering to for the last 3 years. She's gone through horrendous difficulties, a lot of struggles. We've reached out and did extra things to help her. And she's been doing Bible studies now with our care team coordinator, and she just asked for baptism. Isn't that amazing? God is beginning this process. And we have several people in Bible study right now. If you want to learn more about that process of reaching out to people's homes and engaging that process, I urge you to read this book. It's out of print. If you want a PDF copy, you can get one. The family of Marjorie Gray. Marjorie Gray's dead, and her husband has passed as well. But we contacted, John Turcotto contacted her family and said, hey, would you be willing to let us copy this for the sake of those who are longing to engage in this work? And they said, absolutely. Okay, so if you want a copy, we can get you a PDF copy as soon as possible. All right, we just moved into our last move. We're hoping not to move again for a long time. It's expensive to move, but our staff has grown. We're about 10 people now who are paid on staff. And we're really loving how this is going. We have hydrotherapy twice a week now, massage therapy twice a week that we're engaging in. We have 2 clinicians at a time that are helping patients. And it's just been a ton of fun passing out literature, praying with patients, and helping them come into a deeper spiritual walk with Jesus. All right, so we're excited. This has been the most low-stress work I've ever done. It really is. It's just way better. There's no burnout because you're just passionate every day. There's nothing to burn out on. The fire's still fueling. And it's wonderful. So where are we going to head from here? We're getting ready to start some group visits. We are doing some group health teaching sessions. We want to do more. We have a teaching kitchen and a lifestyle support group that's already running, and we want to grow that more. We want to grow our massage hydrotherapy aspects. We want to train more volunteers. We want to grow these life med care teams. We want to start having from our local churches different volunteers who are really excited about health to be able to work with our care team coordinators and start to reach out to patients, because our care team coordinator is going to get overwhelmed. It's coming. And as the churches get involved, they'll start referring people, and it's going to become beautiful more and more and more as we start finally to get involved with reaching out to people in a much more assertive way. Are you hoping for that? Would you like to start doing that? Let's go. Increase cooperation with health and personal ministries leaders at our local churches. We've been engaging that. Launch a lifestyle medical ministry assist. So this idea of bringing together people who can help those who are longing to plant clinics for the purpose of the gospel, for the purpose of loving people, sharing God's love with them, His character with them. That's what we're working on right now. And we're going to support efforts, whether country-based or city-based, in engaging this process and getting the clinics and that process going, and getting clinicians and nurse practitioners and PAs and people who have done all that training involved with the volunteers from the churches and getting us working together to go reach out to the communities. That's what we need. And that's what we need to build and get an understanding of. So this idea of assist health and gospel workers to plant clinics for the purpose of fulfilling the gospel commission. I mentioned that, Three Angels message. Improve collaboration and patient referrals between city clinics and country-based lifestyle centers. So we have a long ways to go, even in our clinic, on doing that, but we've started the process. Offer training and mentoring for leadership to be more effective in each of our mission endeavors. Learning from one another to reach the unreached and be successful in business. So the business side needs to be successful too. So that's what we want this organization to do, and provide resources to help people get started. And we would love someday to have funding to help them get going. And so we're working on those ideas. All right. So that finishes it. I don't know how long I went. Forgive me if I went too long. Let's close with prayer. Dear Lord, we're grateful for just this incredible gift of insight that you've given us. It's taken me so long to get this more clear. Oh, Lord, I just pray that the ideas and the principles tonight may have struck a chord with those who are here, that the passion may burn deeper, that the longing may deepen, that the details may start to work themselves out, and you may build within us this ability, this sense through the Spirit's leading to go out and truly start reaching out to people. People are more depressed, more lonely, more troubled than ever before. And you're calling us to go out and make a difference. Help us do it, Lord. Help us to engage that process and make it beautiful in our lives. In your name I pray. Amen.